Good evening, everyone. I am Dr. Deepak Kumar Rathi, Associate Director, Urology and Kidney Transplant. I welcome you all in this webinar where we will be talking about kidney disease, how to prevent them, what are the most common kidney disease. We will talk about the lifestyle modification which we can do to prevent them. And we will talk about kidney transplant, dialysis, and what is the latest advancement in the treatment of kidney disease and the kidney transplant. To have this discussion, we have with us Dr. Prasun Ghosh sir, who is the head of transplant for last 16 years. The department started at Medanta Hospital, and under his guidance, we have completed more than 3,000 kidney transplants. Sir is the chairman of Urology, Renal Transplant, and Robotics at Medanta Hospital. Then I would like to welcome our nephrologist, Dr. Abhyuday Rana, who has been an integral part of our Kidney and Urology Institute for last almost 10 years. And lastly, I would like to welcome Dr. Vijay Kejriwal sir, who is one of the renowned pediatrician at Kolkata. I mean, he is a very senior pediatrician there. And sir, welcome you in this webinar. We are delighted to have you in this discussion because normally we talk about the kidney disease, we always talk about adults, but today we will get insights from you about children also. So firstly, today is World Kidney Day, and firstly I would like Dr. Prasun Ghosh sir to start the discussion about the World Kidney Day. Sir.
Thank you, Deepak, Dr. Deepak, for this kind introduction, and welcome to all of you on this very auspicious and special World Kidney Day. The importance of the day, this particular day, does not lie as on the day or the date or the month or the year. The importance is in identifying a particular time of the year or time of the day, time of the month, to dedicate it entirely to at least one important organ of the many important organs in our body, which are the kidneys. So basically, it is not only that this day we're looking after your kidneys, but this is the day where you will have the maximum information pouring out from all the platforms across the world. So that integrates it and puts us all at a global perspective of the kidney disease. Now, to make things clearer, as we all know and the general public knows about it, kidneys are two bean-shaped structures situated at the back in an adult and a child, and irrespective of the gender. Some people may be born with one kidney, some people may be born with number of kidneys. Anatomical variations are there, they do exist, they have been reported. But ultimately, these are the basic units which are blood filtering units or the filtration house of our body. The end product of that filtration presents out as urine. For clearer understanding, the blood gets converted into urine inside the kidneys. But just to think of it, how important these kidneys are, that they do not just only perform as a filtration unit, but it's about 5 to 5 liter of blood flowing around in the whole body of an adult male or a female, right? That thing is processed, concentrated, and redistributed. And the end product is only about a liter or a liter and a half of urine in 24 hours. So there's a lot of complex procedures being undertaken by the kidney in terms of electrolyte balance, in terms of concentration, in terms of filtration. And there are multiple areas of the kidneys which are responsible for that. So urine formation, to concentrate that 4.5 to 5 liters of blood to about a liter and a half of urine, takes a huge effort by the kidneys. And it is not only the urine that is being produced by the kidneys, they also perform other different functions. Let's say the production of erythropoietin, which is important too, which regulates the hemoglobin in somebody's body. So that is dictated by the kidney. The production of vitamin D, which is a very important hormone for your bone metabolism and other things, that is provided by the kidney. Plus a endless list of other factors. I will not go into details of all that, but let me begin this whole interesting and pretty much engrossing webinar by saying that these kidneys are the most fantastic filtration organs that God has given us, and it is our duty to protect, take care, and ensure the longevity of these two organs. With this message, I would like to start this discussion, and I would solicit input from our other panelists as well. Dr. Abhyuday, your views on this day and the kidneys.
As you rightly said, VIP. So this kidney is one of the most important, if not the most important organ in our body, and we should be treating it like a VIP. It not probably the most common function that everyone thinks is just producing urine and excreting the waste products, but there are so much things that a kidney does in the background that it does not get manifested as much as possible. Like you rightly said, controlling your pressure, controlling your hemoglobin and everything. So we should be treating this organ well so that it keeps functioning in the background and maintain the homeostasis that it is required for it to work well within the body. And like you rightly said, it's not a day that we should be talking about this kidney disease or the awareness of this kidney problem. It should be a continuous effort from everyone behind to keep this vital organ in our body healthy so that we try to tackle this problem of kidney disease as much as possible.
So now I would, is Dr. Deepak is not audible. Dr. Deepak can unmute yourself. Yeah.
Thank you, sir. Thank you, Prasun, sir, and thank you, Dr. Abhyuday, for your insight on this day. Now, I would like Dr. Vijay Kejriwal, sir, to say what is his message on the World Kidney Day.
Thank you, Dr. Deepak. Thank you, Prasun sir and Dr. Abhyuday, for very beautifully outlining the importance of this World Kidney Day. And my idea is that if we take kidney care from the very conception, from very, say, when we conceive the child to the childhood, if you can be mindful of the kidney diseases and be mindful of the symptoms, early symptoms, to prevent, say, recurrent urinary tract infections. If we don't self-medicate, and if lifestyle, we follow certain norms in childhood, then in adulthood, the kidneys will be stronger and safe. So we, as pediatrician, we must be always, our focus should be to be aware of the urinary issues. Suppose we must not ignore the urinary symptom. I will advise parents also not to ignore urinary symptoms. Might be the higher frequency or burning or any red color urine or whatever abnormal symptom, they must report to their pediatrician and immediately take proper precautions and address the issues. And again, the self-medication issues in misuse of antibiotics, misuse of painkillers, equally important in childhood also. Then again, hydration, very important in summer season or say in sports. Children are very active, but the fluid intake is at times not adequate. So again, the infections, say throat infections, dental infection, any severe diarrheas, we must be very proactive in treating the diarrhea, dehydration and infections so that we can protect kidney in childhood. So mindfulness and awareness is very important. That is my take.
Thank you, sir. Thank you for your insight. So, in starting today's discussion, so firstly, I would like Dr. Abhyuday to tell us about what are the common symptoms of the kidney disease and why is the chronic kidney disease termed as silent killer?
Thank you, sir. So you rightly said it is one of the most silent disease that affects human body, and by the time we get those subtle signs and symptoms, the kidneys are already damaged beyond repair. So in general, most of the disease works silently behind the doors, and by the time your kidneys start to show some symptoms, they're already damaged beyond 75 to 85%. But when you can have some subtle signs initially, which can compel you to get yourself tested for kidney problem. One of the most important symptoms that patients come to us is some swelling over their feet, which begins around the ankle and gradually increases up to their legs. Patients tend to complain that during long sitting, they start to notice that their socks have started to make indentation on their legs. This is one of the important subtle signs in all high-risk patients, where if they start to notice this, they can come to their healthcare provider and get themselves tested. More and more, as the kidney mass started to deteriorate more and you lose more kidney function, you start having symptoms which are like you tend to have nausea, your appetite goes low, and you start to feel nauseous throughout the day. These are certain signs of advanced kidney problem. And gradually, over the time, your urine output starts to drop, and you start to see more and more pronounced edema over your legs. There are few other symptoms that patients do come with us is they start to see some froth in the urine, which they complain that while they're urinating, they see a lot of bubbles or they see a lot of froth in the urine. That's an initial sign that they can check for leakage of protein in your urine. If they are in high-risk population, like patients who are diabetic, who are hypertensive, or who have been taking painkillers for a very long time for any chronic ailment, such patients, if they do see these bubbles in the urine, should get themselves tested as quickly as possible. And over the time, if there is any unexplained anemia, that is, your hemoglobin tends to be on a lower side, despite no obvious cause for it. You've been eating well, you're not leaking blood from anywhere, but still your hemoglobin remains on the lower side. It is always worthwhile getting tested for kidney function so that we pick up the kidney problem as early as possible.
Thank you, Dr. Abhyuday. And now, in continuing the same discussion, I would like to ask Dr. Vijay sir, what are the symptoms which we see in the children? Are they some different from the adult? And as you told in your welcome also that, there are some, what are the red flags which a parent, if he sees those red flags, so they should immediately consult the pediatrician or the nephrologist.
Particularly regarding symptoms, first of all, urine. Symptoms as regards any fever, we must ask about urinary symptoms. Is there is more frequency? Is there any burning? Is there any red color urine? Then again, swelling, puffiness around the eyes, swelling around the eyes, swelling of the feet. They are also common in children with nephritis type of diseases. So this swelling of eyelids, swelling feet, these are also must be taken care of. And again, any infection I told you earlier that can lead to this urinary issues. So in say newborn also, supposing neonatal infancy, I'm just giving you an example. 8 or 9 months baby came to an ICU, very bronchiolitis, almost impending respiratory failure. And accidentally, while giving the blood examination, clinically it was nothing. Test was clear, X-ray was clear. And in the investigations, when we sent the blood routine and everything, and we also did the kidney function also. And it was in the evening, it was found that there was high urea and high creatinine. So this respiratory distress in this infant, it was the presentation of this uremia. So immediately the child was shifted to higher center. So we must be mindful of the urinary symptoms, particularly any fever, we must ask urinary symptoms. And I already told you red urine, or say burning urine, frequency urine, frothy urine, or say oliguria, there is a less amount of urine without any obvious cause, then swelling around the eye. These are the symptoms you must watch out for in children. And again, it might be silent at times. There may be no symptom, and the child is coming with other symptoms not related to urine. Still, we must have one routine examination, and where we go for blood, we should have at least urea, creatinine, and basic kidney function test. We must ensure every time, whatever other symptoms the child is presenting with.
Thank you, sir. Prasun sir, I would like to ask you that chronic kidney disease being a silent killer, and especially in the adult population. So, after what age you will suggest the people to go for the regular health checkup and the importance of that to detect the chronic kidney disease in the early stage so that we can treat it in the time and prevent it also?
I think that is a very important question in terms of the burden of disease in our country. Annual health checkups, which are performed by most of the hospitals, corporates, your workplace, these are not only just the way to assess your health, but they serve as a baseline statistic of where you stand on your health record as of today. Now, the importance of this becomes more evident because on subsequent health checkups, if there are an interval change in the values of certain important tests, then that draws your attention that something needs to be done or something is wrong with me or my system, which needs evaluation. So the importance of a health checkup done annually is of paramount importance and cannot be ruled out. This is one thing because there is no other modality to put a meter on yourself and check how good or bad in terms of my health parameters I'm doing. This is the only way, and it needs to be followed and probably enforced. I can't use that term, but it needs to be diligently followed. Now, coming to the impact of these outcomes, especially in terms of the kidney functions. Kidney functions, by commonly I mean the urea, the creatinine, the urine routine findings, the ultrasound, so on and so forth. Ultrasound gives you a rough anatomical estimate of your kidneys. The blood reports give you a surrogate marker or a vague marker regarding the kidney functions. There are specialized relevant tests focused specially to find out about kidney functions in terms of DTPA, in terms of DMSS scans, various scans which can be used too. But does somebody need to undergo the entire gamut of investigation? Answer is no. You begin with basic tests like a urine routine microscopy, a urine albumin creatinine ratio, ultrasound of the KUB region, which delineates the anatomical functions of your kidney, and basic blood reports like hemoglobin, like a complete blood count, a renal function test, a serum calcium, so on and so forth. So you don't need to go into expansive tests looking after your kidney functions. If either of these tests throw up an anomaly, that is the point where you escalate to the next level, and which will be determined depending upon how you are doing, what symptom have you presented with. Now, this is the scenario for the group of people or the society who are asymptomatic. They are in the best of their health. They are perfectly placed health-wise. They are young. So coming to the question of when to begin, I would say once you are in your teens, the younger you are, the better it is. That gives you a baseline. And then subsequently, as you go down, a yearly health checkup becomes very important because this is the only way you can monitor your health parameters. Now, coming to the burden of chronic kidney disease. Chronic kidney disease is a very specific and a well-curated term for that group of patients in which the kidney functions have gone to such a point where these functions cannot be reversed. So when I say a chronic kidney disease, I'm not trying to say that the patient has reached to that particular point from point A to point B, and this was not reversible in the first place. Only when I have assured myself and proven it beyond doubt that these functions cannot come back, that I would label it as a chronic kidney disease, which are further subclassified into type 1, 2, 3, 4, 5, which is a progressive decline in your kidney functions, and that increases the stage of your chronic kidney. Stage 3 would be somewhere bang in the middle. Stage 1 and 2, well, by definition, you have to progress to that stage. Stage 3, after stage 3, 4 and 5, there's a different set of parameters for that. Controlling your kidney functions, monitoring your kidney functions, and these are all a result of how your body is doing in terms of other health parameters. Let us say there are factors which can be controlled and contained. Obesity is 1, hypertension is 2, diabetes mellitus is 3. These are the most common. Metabolic syndrome is 4, smoking 5. These are conditions which can be monitored and reversed. Please make a good note and a constant watch on these so that your kidney condition stays healthy and it doesn't progress any further. I would not elaborate much on that. I would leave that to Dr. Abhyuday and Dr. Vijay for more elaboration. But in short, monitoring becomes essential. Health checkups should be made mandatory after, let's say, 2025, and a close follow-up for your kidney functions and other metabolic parameters will ensure a good kidney health.
Thank you, sir. I think this is for the audience that, the most important thing is the regular health checkup so that we can detect the disease early and we can start the treatment in time. So in continuing the same discussion, I would like to ask Dr. Abhyuday that what are the impacts of high blood pressure and high blood sugar on the kidney? And when is the blood pressure and the sugar, they start affecting the kidney? And what is the burden of disease in India? And what are the prevalence of kidney failure because of the blood pressure and sugar?
So we understand that India is probably the diabetes capital of the world. The prevalence of diabetes is on the rise, is rising, and by the looks of it, will continue to rise. Diabetes is one of the most common risk factors for chronic kidney disease. It initiates the problem, and in other cases, if the kidneys are already damaged, it potentiates further risk on the kidney. Like diabetes, hypertensive is another leading cause of chronic kidney disease, and both of them starts to affect the vessels, bringing in the blood to the kidney. And gradually over the time, because of high pressure inside your kidneys, blood vessels starts to get damaged, and eventually they lose their function of the most important function of filtering out the waste products. The first and the foremost symptoms that we see in such patients is that they start to leak a lot of protein in the urine, which is the initial pickup point, which very commonly gets missed among diabetic patients. If you see, a lot of diabetics come to us with a raised creatinine, which they have been referred from their primary healthcare provider, saying that you now need to visit your kidney physician because you now have a kidney problem. I would suggest rather the first sign that when they started leaking protein in the urine is exactly the time when they should be referred to a specialist so that we can pick this up early. We can now initiate treatment, and we now have such potential drugs that when started early can completely negate the further decline of the renal function in the future. So it is not a lost cause. Diabetes kidney disease does not mean that we do not have a treatment and we will eventually progress. If picked up early, the time when you are only leaking protein and your creatinine, that is your kidney function, is still okay, we have n number of drugs now in our armamentarium. Very recently, SGLT2 inhibitors have come. There are more drugs that have come up in the pipeline, which can halt the progression of kidney disease at the very onset. Hypertension potentiates the damage on the kidney that the diabetes has already started. I commonly use this term when I'm educating my patients कि अगर डायबिटीज ने आपकी किडनी में एक आग लगा रखी है तो ब्लड प्रेशर या रेस्ड प्रेशर एक पेट्रोल या केरोसिन का काम करता है, इस आग को और बढ़ाता है और इसको और जल्दी बढ़ाता है. And that is how your kidneys deteriorate much faster if you have a high blood pressure in the background of diabetic kidney disease. Like I said, Dr. Ghosh rightly put up the point of getting yearly annual checkups for patients to pick up early kidney disease. I would just like to add on the point that patients with high risk factors for developing kidney problem, that includes patients who are diabetic, patients who have hypertension in the background, patient who has a family history of kidney problem, or like I said, patients who've been taking a lot of painkillers, which is now one of the more emerging risk factors for developing kidney problems. These are the patients who should get annual health checkups done more frequently. Like I said, yearly, maybe sometimes it could be more frequent, maybe a quarterly or maybe biannually they should get the reports done. And quickly, if they see any subtle signs of kidney problem that includes some leakage of protein, some increase in the creatinine level, or if you see any subtle changes in the shape or size of your kidneys on the ultrasound, that is when you should meet a specialist and start your treatment as early as possible. Catch them early, treat them early, and heal them early. That should be our motto for the World Kidney Day this time. Thank you.
Yes.
Yeah, very, very correctly put up, Dr. Abhyuday. The theme for this year World Kidney Day is also kidney health for all. So I would like to ask Dr. Vijay sir, UTI is a very common problem we see in the pediatric population in the children. So when does these UTI they start affecting the kidney? And what is the impact of infection on the kidney, and what the parents should do when a child is having recurrent infections?
You see, Dr. Prasun Ghosh rightly mentioned about monitoring. Monitoring is the most important thing. Then Dr. Abhyuday outlined the importance of controlling diabetes, mellitus, and hypertension. I would like there is no age for this UTI. Actually, we must go for anomaly scan before pregnancy because there are so many congenital urinary abnormalities regarding kidney, ureters, and this genital urinary tract. So, just after birth also, just after delivery also, child may have recurrent urinary tract infections, say polycystic disease or say vesicoureteric reflux or posterior urethral valve. There are so many conditions which can cause recurrent urinary tract infections in neonatal and this infancy. Then again, you say under 5 for school-going children or adolescents, particularly girls, they might not have any symptom. As rightly pointed out by Dr. Ghosh and Dr. Abhyuday also, that unexplained anemia without any obvious cause, then unexplained failure to thrive. Maybe the recurrent urinary tract infection, UTI, maybe the cause behind that. So we must be mindful. We must keep monitoring. And I already told you earlier, there may be no symptom, and there may be symptoms like burning frequency, red urine, frothy urine, a small amount of urine. There may be symptom, may not be symptom. Particularly girls. So many asymptomatic urinary tract infections are there, and they are suffering from chronic anemias. So we must monitor, as Dr. Prasun was rightly said, symptoms also, and kidney function should be a part, at least urine examination, routine urine examination. If urinary symptoms are there, then culture, then this your in blood kidney function, particularly urea creatinine. I think should be routine in all the examinations. Whenever you do any blood and whenever you advise some routine examination, you must go for it.
Thank you, sir. So I would like to ask Prasun sir that as a urologist, the most common scenarios which come in our OPDs are one, the patient with kidney stones, and the second, the elderly people with the prostate. So how are these two problems, the kidney stones and the prostate, they can impact our kidneys, and what is your message for the people who are suffering from these two?
So in any busy urologist or even normal urologist OPD, these two diseases, renal stone disease and a bladder outlet obstruction, the first one irrespective of age, the second one mainly seen in the elderly or the geriatric population. But the first and the foremost point about kidney stone disease is that it is kind of a paradigm saying that if once a stone former, you are a stone former for life. Stones don't form out of thin air. If you apply a bit of logic to it, think about it. There has got to be something wrong with your blood chemistry or the urine chemistry or the interface where the blood is changing into urine, which are your kidneys. If you happen to have stones, let's say in both the kidneys, it means that the cause has to be something more central, which is the same blood flowing into the both kidneys or the same urine coming out of both the kidneys. These usually are metabolic defects or metabolic conditions like a simple raised oxalates, urinary oxalates are raised, calcium metabolic deficiency. There are n number of lists for this. So when we are talking about stone disease, I say very clearly to the stone patient that it is essentially divided into three parts. First part, treat the emergency. The patient will come jumping to you with a pain, with a fever, with all kinds of symptoms, vomiting, puking. Settle him down, find out where the stone is and what. Part 2, treat the stone. You operate, you put a stent, you do a procedure, you do a lithotripsy, you give him a medical expulsion therapy, do whatever, but that is part 2. Part 3 becomes the most essential, wherein we forget as to why the stone is forming. Why should he form stone? So starting from a genetic cause to a whole list of his metabolic evaluation and disorders, the list is endless. So part 3 becomes important for the simple reason that if we evaluate these patients, an index patient coming to us, we go up to part 2 and send the patient home. 50% of these index patients will come back to you with a new stone in the next 3 to 5 years. That is a normal history, natural history of stone disease. The reason to evaluate him metabolically to get an outcome is that if we find a cause and we treat it, it is not to say that he will stop forming stones. No. What is going to happen is we are going to slow the process down. So what, as in terms of a recurrence, would have been happening every 3 to 5 years, probably we can extend that to about 10 to 12 years. So lesser number of hospital visits and a good monitoring tool to keep track of his stone disease. Now, another important factor, as Dr. Kejriwal would also agree with me, younger the patient with the stone disease, more the chances of his outcome and longevity in terms of kidney life. If there is a child who's presenting with stone disease, there will be a list of pediatric issues which can, starting from a distal renal tubular acidosis to a reflux disease to, the list is endless. So one has to be very vigilant, very careful, and very observant of these facts, especially when the age stratification comes for stone disease. Now, this is an overview of the stone thing. So stones, number 1, do not form out of thin air. You need to treat the stone and the cause. Younger the patient, higher the risk stratification. And all stones, patient needs to be stone free, to put it in one simple term. Now coming to the prostate part. Now, the normal presentation of these patients, they would come and say, sir, mujhe prostate ki takleef hai, prostate ki bimari hai. But in a bigger way or in a broader perspective, that is essentially what we are dealing with is bladder outlet obstruction or a bladder outlet issues, which can be starting from an enlarged prostate to a high bladder neck with a small prostate to an underactive bladder. So the important part to that prostate and the outlet is that bladder acts as a conduit and a reservoir for urine which forms from the kidneys, and the prostate and the outlet is the outlet to it. If the bladder is not able to drain completely, or it is having a large residual volume, or it is working under high pressure to push the urine out, the upper tracts, by which I mean the kidney and the ureter, may get affected in terms of a secondary hydroureteronephrosis. The renal functions may go up, the serum creatinine may run up. The patient may present with recurring urinary tract infection because of a high pressure voiding. The patient may present with hematuria, or on an ultrasound, a diverticulum or all the back pressure changes happening in the bladder because of an obstructed outflow. These may be very evident on an ultrasound. So these are a few things one need to be very careful and mindful of and decide the treatment of these patients accordingly. If the patient has a altered renal function because of an outlet obstruction, surgery should be the first choice for it. You are not waiting in this patient. So all prostates are not to be chased with a knife. It is important to know the difference between a surgical group of patients who need surgery immediately versus the first line, which is the medical management, treatment with medicines to ease the bladder outlet and restore bladder and the flow patterns. So these two things become important because stone disease is across the whole kind of lifetime spectrum. The prostate issues, I say to all my patients, 50% of the patients above the age of 50 will face a bladder outlet issue. It could be in terms of as many symptoms of frequency, urgency, getting up many times in the night, poor stream, pushing to initiate a flow, or a sense of incomplete void. The symptoms may vary, but generally the spectrum is towards the geriatric group, after the age of 50 most. But this is not to say in a blanket statement that outlet obstruction cannot exist before the age of 50. Children may present with posterior urethral valve since birth. The children may have a dysfunctional or a neurogenic bladder since birth. So the disease burden is both ways. It is important for us to understand as the effect that is going to have on his renal function and the kidneys, because these are something which is in a constant phase of evolution. So these need to be protected.
Thank you, sir. I think the message is very clear that if we have got stone or the prostate issue, we must consult our urologist, and so that we can start the treatment in time, and we can prevent the effect of these two on our kidneys. So Dr. Abhyuday, we have talked about chronic kidney disease. So I would like to know from a layman point of view that, when is the chronic kidney disease labeled as kidney failure, and what are the treatment options available presently if a patient has got kidney failure?
So, chronic kidney disease, like Sir said, is basically a group of disease clubbed together where your kidney function is below functioning is below 60% of its normal value, and it should be lasting somewhere more than 3 months. There is a other subset which is called an acute kidney injury, which can happen with a sudden decline in your renal function, but there is a chance of reversibility and you completely go back to normal. But specifically to term a disease as a chronic kidney disease, it has to be below a GFR which could be roughly translated as a percentage of how much your kidneys are functioning. That is below 60 for more than 3 months. And we have categorized into 5 stages of chronic kidney disease based on this GFR value, where the first and the second is almost above 60 GFR. And once the GFR starts to fall below 60, we then come to a stage 3, 3A, 3B. 4 is something between 15 to 30. And once your kidney function is below 15%, and that is when we term you as chronic kidney disease stage 5, or which was previously termed as an end-stage kidney disease or end-stage renal disease, or sometimes also referred very loosely as kidney failure. And as of now, we have two important pathways that we can choose for patients when his kidney function starts to fall below 15. One can opt for what is called as a dialysis or a kidney replacement therapy, where in any form your blood is purified out of all the impurities, that is urea and creatinine and extra fluid, by an external help of a machine. This could be further subclassified into a hemodialysis, in which your blood is taken out and via a filter purified and your blood comes back to your body. Or it can be a peritoneal dialysis, where your own body's peritoneal membrane serves as a filter by instilling a dialysate of somewhere around 2 liters in your tummy, abdominal wall. It stays there for 4 or 5 hours, and after cleaning and exchange of the waste products, these fluid is removed out. The second pathway is called as kidney transplant, where in India we have two forms of kidney transplant. One is a living donor kidney transplant program, which is the most prevalent. Almost 90-95% of transplant happening in India happens from a live related donor from the family, who is a fit donor who can donate one of the kidney to the patient. And provided he or she, the donor, should not face any problems post donation. And the second one is what is called as a disease donor or a cadaveric donor kidney transplant, where someone who's probably after an accident or a brain injury is now termed as brain dead, and he or she has opted for organ donation post this, and one can get kidneys out. This is controlled by the National Organ of Transplant committee over here, which has an headquarters in Delhi. And we have a program running among the Delhi NCR, and most of the patients are enlisted in them, and according to their rankings, their need for a transplant, one gets the kidney out of a system that is very commonly used within the states and the regional wise. So as of now, summarizing it, we have two important pathway that we choose, either a kidney transplant or a dialysis for now.
Thank you, Dr. Abhyuday, about giving the insights on kidney failure. Now, I would like to ask Dr. Vijay, sir. Sir, what are the most common causes of kidney failure in the children? And are the treatment option different or the same as the adults?
You see, in acute diarrheas, with severe dehydration not properly treated, can go to this renal failure. These are the very common in say summer season and peripheral areas where still severe dehydration is not properly treated. Then again, recurrent urinary tract infections leading to say pyelonephritis, chronic pyelonephritis. Once the chronic pyelonephritis sets in, then the course is same as Dr. Abhyuday has told. When the renal function deteriorates quite low, then the treatment planning, I think Dr. Abhyuday will also agree that it goes on the same lines. So, as Dr. Abhyuday said, that we must detect early, we must treat early, we must prevent early, and treatment depends on the cause. We must not allow the kidney function to deteriorate. Say, sir has told you about obstructive uropathy. In children, obstructive uropathy, particularly from posterior urethral valve or severe form of vesico-ureteric reflux, or say POJ obstruction, or say renal calculi are also said that they are very common in younger age groups. So if you treat the cause, you treat the posterior urethral valve, you treat this vesico-ureteric reflux, you treat the recurrent UTI, and not allow the kidney function to deteriorate. Again, I will like to just share. Dr. Vidya told that hypertension, diabetes. So I think the foundation of the diabetes and hypertension is laid in childhood only, because of this lifestyle issues. Say so many social media, then physical inactivity. I would like to add, physical inactivity is very important. Taking junk food is very important. Then salt intake, that is also a part of junk food, you can say. So not taking adequately hydrated, not taking adequate water. So awareness about the kidney disease, so that it doesn't kidney function doesn't deteriorate, and particularly we build the foundation, solid foundation for the kidney care in the childhood, so that in adult these issues do not arise. And once the kidney function deteriorates like anything, then I think Dr. Abhyuday course is the same as pediatric or adult kidney care.
Thank you, sir. We will continue the discussion. There are a couple of questions, so we will take the questions from the audience. So, Prasun sir, one of the patient is asking कि transplant surgery हो चुका है and fever आ रहा है. So what should we do?
ट्रांसप्लांट कितने दिन हो गए ट्रांसप्लांट हुए?
I think he has not mentioned about this. The question is only this much.
So if the transplant has happened very recently और फीवर आ रहा है अगर पेशेंट को, तो सबसे पहले बिना हेजिटेशन के आपके जो नियरेस्ट हेल्थ सेंटर है, जो नेफ्रोलॉजिस्ट आपके टच में है, वहां जरूर जाए. फीवर के कारण बहुत कुछ हो सकते हैं. अगर आप ऑपरेशन से जस्ट फ्रेश है, तो वुंड इन्फेक्शन से लेके वुंड रिलेटेड कॉम्प्लिकेशंस एंड इश्यूज से लेके आपके चेस्ट इन्फेक्शन, चेस्ट में कोई लीजन है, या आपके थ्रोम्बोफ्लेबाइटिस है, या कॉमनली यूरिनरी ट्रैक्ट इन्फेक्शन, क्योंकि अगर रीसेंट ट्रांसप्लांट है तो शायद स्टेंट भी होगा, आपको फोलिस कैथेटर जो होगा वो भी अभी निकला होगा. सो ये बहुत कॉमन से कारण है. तो यूरिन कल्चर होना चाहिए, सीबीसी, टीएलसी, डीएलसी होना चाहिए, आपका चेस्ट एक्सरे होना चाहिए. कुछ एक टेस्ट है जो डेफिनेटली थोड़े से हायर एंड पे हैं, पर ये सब डिसाइड करने वाले आई थिंक आप बेस्ट होगा कि आप नियरेस्ट हेल्थ सेंटर पे जो आपके नेक्स्ट नेफ्रोलॉजिस्ट जो आपके टच में है, या जो मेन नेफ्रोलॉजिस्ट है, उनके पास जरूर जाए और उनके पास जाके इन चीजों का इवैल्यूएशन एंड अप्रोप्रिएट एक्शन लिया जा सके. पर अगर आपको ट्रांसप्लांट हुए काफी समय हो गया है और फीवर अब आ रहा है, तो कारण सेम कारण हो सकते हैं, बट उसमें जो स्ट्रैटिफिकेशन होगा वो थोड़ा डिफरेंट होगा. उसमें वुंड रिलेटेड कॉम्प्लिकेशंस या उससे फीवर अराइज करने के कारण कम हो जाएंगे. बट यूरिनरी ट्रैक्ट इन्फेक्शन से लेके चेस्ट इन्फेक्शन से लेके एब्डोमिनल इन्फेक्शन, द लिस्ट इज एंडलेस. ये कॉमन कारण होते हैं. प्लीज अपने नेफ्रोलॉजिस्ट से जितना जल्दी मिल सके या बात कर सकें, प्लीज कनेक्ट कीजिए उनके साथ.
Thank you, sir. And the another question is to Dr. Abhyuday. So one of the patient is asking that I have undergone kidney transplant on January 25. My urine is still foamy and creatinine is 1.7 to 1.9. Is that a concern?
So again, sir, there could be a number of reasons why someone would still have higher creatinine post-transplant, and still the urine could be foamy. There were a lot of investigation that we need to do. This could be recurrence of आपकी पुरानी किडनी की प्रॉब्लम जो वापस आ गई. ये हो सकता है ये इनिशियल स्टेज ऑफ रिजेक्शन हो सकता है ये फोम यूरिन एक्चुअली यूरिन में प्रोटीन ना जा रहा हो और कॉन्सेंट्रेटेड यूरिन के वजह से आपकी यूरिन फोमी लग रही हो, and then your creatinine level is remaining around 1.7 to 1.9. There could be n number of reasons for it. आपके डोनर की किडनी कितनी अच्छी थी, कितनी हेल्दी थी, आपसे उनकी बॉडी का मास कितना इक्विवेलेंट था, and there could be such n number of reasons how which will determine why your creatinine is somewhere around 1.7 to 1.9 despite 1 year of transplant. This will actually require a detailed evaluation and probably a follow-up with your transplant nephrologist. He or she can guide you best why there has been the course of your transplant being like this. Is it normal for you? Is it abnormal? What can be done? So this requires a detailed evaluation by the transplant nephrologist and OPD. I believe so. That is where this will be solved.
Yeah. So, sir, I would like to ask Dr. Prasun, sir, that we know the treatment option dialysis and kidney transplant. So, why is the kidney transplant the treatment of choice? And in the recent year, what have been the developments like in the as far as the donor surgery is concerned? We know that the laparoscopic donor nephrectomy is the standard of care, where the minimal invasive benefits are passed on to the donor. So, what have been the advancements in the last decade for the recipient, the patient who is receiving the kidney?
So somebody, for a patient who has reached a CKD stage 5, where he needs some kind of supportive care to carry on his normal functions in terms of the blood purification, as Dr. Abhyuday and Dr. Vijay both concurred that either it's a hemodialysis or a peritoneal dialysis or renal replacement therapy, which is a kidney transplant. Now, across the world, there is enough evidence in literature to say that of the 3 possible available treatment arms, the best outcomes are of the kidney transplant group of patients. There's a reason behind it. Data shows, and there is enough data to support that patients who are on dialysis, especially hemodialysis, the 5-year survival is almost 50%, as compared to patients who undergo renal transplant, a successful one, and patients who have maintained their transplant, their 5-year survival is somewhere close to 90 to 95%. So, in simple terms, renal transplant effectively treats your kidneys and replaces the nephron mass with another nephron mass. Dialysis is something which is purifying your blood on a regular basis because you are attached to a machine which clears and purifies and detoxifies your blood. In our center, especially at Medanta, we are a very active pro-transplant unit, and we basically believe that dialysis is a bridge to transplant. This is not to say that dialysis is not good for patients. Dialysis is a very effective arm of treatment, but it should be reserved for those patients who cannot undergo a renal transplant out of whatever reasons, social, medical, surroundings, n number of reasons it could be. People who cannot get a transplant can be kept safely on dialysis. But for people who can undergo a transplant, should undergo a transplant, because that is the best modality of treatment with the best outcomes, and effectively it makes or transforms you into a socially equitable being with the other members of the society. You have to contribute back to the society, and we are making you fit for that. Now, coming to the types of transplant you can do. Transplant involves a donor and a recipient. For the donors, the harvesting technique, that is removal of the kidney or taking of the kidney, has always followed the golden rule of a laparoscopic donor nephrectomy, by which I mean a keyhole surgery for the donor, because the donor is the VIP of the program. He or she should not be put under too much of pain and duress, and recovery should be faster. All of these factors can be achieved by application of minimally invasive surgery, which is laparoscopic donor nephrectomy. And now that has become the standard of care across the world for the donor surgery. The first transplant happened in 1954 in Boston, United States. From till then to about 2010, about 70 odd years, these surgeries were being done in the classical open surgery way, whereas the patient would receive an incision on the tummy and do it. Now imagine a patient who's the recipient is immunosuppressed, low on proteins, more prone to he's a cachectic patient, more prone to infections and other things, and you undergoes a big major open surgery as a transplant. The wound-related complications and the recovery becomes questionable and a prolonged issue. We challenged this theory and propagated that why cannot, when the entire world is moving towards minimally invasive surgery, why can't the benefits of the minimally invasive surgery be translated into the recipient? Because he is actually the person who needs the most of it. So then we developed a platform, the robotic platform, that has used a robot to do the surgery in the recipient, and we named it the robotic kidney transplant. This happened in the year 2012, wherein by means of a small periumbilical incision, a small incision around the navel, you can put the donor kidney inside the recipient and do the rest of the surgery using the robot through 4 little holes. So that immediately, and we kind of designed, devised, researched, and presented the study across elsewhere, everywhere in the world. So that evidence that came out of it, that this was a surgery which can be done safely in the patients, reducing the surgical morbidity dramatically. Wherein the recovery phase of the patient, this is very fast, quick recovery. Blood loss is minimal, the wound is minimal, wound-related complications are minimal, analgesic requirements are minimal, out of bed is much earlier than open transplant surgery patients. All these benefits translated to the surgical recovery of the patient being much quicker. But would these group of advantages qualify as to into saying that robotic surgery is better than open surgery? My answer to that is no. Robotic surgery is a safe alternative to open surgery by hugely reducing the surgical morbidity and achieving and attaining the same outcomes in terms of the overall transplant results. By which I mean the rejection rates, the infection rates, the other medical complications would still remain the same. The biggest advantage being the surgical morbidity dramatically reduces. We have been doing this surgery and we devised and developed it and showed it to the rest of the world since 2012. And we have enough patient testimonials and data and literature to say, and our present own published papers to say that this is definitely an area that needs to be explored. More and more centers are coming up with this and translating the benefits of minimally invasive surgery to the recipient as well. So if I summarize, renal replacement therapy, the best modality of treatment. Patients who cannot undergo a transplant, hemodialysis, the dialysis arm is the best arm. Of the treatment options available, minimally invasive approach to the entire donor and recipient pair can be given.
Thank you, sir. So, Dr. Abhyuday, there are a couple of questions for you. So, one of the question is that there is a patient who has got a creatinine 1.7. The ultrasound is showing echogenic and little shrinkage of the kidney. Their nephrologist is also suggesting that it is, early stage CKD. So, what would be your advice for them?
Definitely, like we were discussing, CKD encompasses important point being your creatinine higher than usual value that translates to a lower GFR for more than 3 months, or there is a structural abnormality in your kidneys, which is visualized as an echogenic kidneys, which is also mentioned by the patient himself. So definitely the patient is a case of chronic kidney disease in an early stage. Now, a very important point that I would like to highlight over here is one, the primary care provider and the nephrologist should take all their efforts in finding the cause of chronic kidney disease. It is always better to know your enemy, what you are fighting against, because by knowing the disease, one can give them actually disease modifying treatment, which could prevent any further damage in the kidney. More so, you might be well prognosticated about your kidney problem, whether this is a disease that will progress, whether it is a disease that, if treated, can be halted, or it is a disease, irrespective of whatever treatment you're going to get, will continue to progress and eventually end to an end stage kidney disease, where the question of getting a kidney transplant would come up, where we would be well informed and will take a more judicious call on whether a patient with such kidney disease, such background disease, should go ahead with a kidney transplant. What will be the risk of the recurrence of such disease? Thus, I would, on this platform, would like to request all the primary care providers and the nephrologists to try and give a name to the disease, to give a diagnosis to the problem. Just labeling them as chronic kidney disease does not serve the purpose. Eventually, they would continue taking treatment here and there and eventually progress and end up landing up coming to the transplant surgeon for a transplant. And we don't have a clue what caused the problem. And we are in the dark what will happen post-transplant. So such early disease should be, like it is picked up early, one should strive to form a proper diagnosis by either doing a kidney biopsy or doing more tests. And then probably that would aid the eventual progression of this disease in a better way.
Thank you, Dr. Abhyuday. I think the message is clear that finding the cause of the kidney disease is of paramount importance. We will take one last question, then we will wrap up our today's webinar. This is a very good question, again to Dr. Abhyuday only, that how a kidney patient can cope up with the severe weakness and fragility.
Very important question that most of the patients come to me in OPD and tells me that I'm getting weak. My creatinine is so, I am getting weak. I don't have the energy to work. And it eventually boils down on a very, very strict dietary restriction, which they either self-impose on themselves or has been imposed by their well-wishers and relatives via social media. So there is a generalized myth among people that consuming protein is a taboo in chronic kidney disease patient, and patients starved for their life. They are not given pulses, they are not given any kind of any protein containing normal diet. We must understand a normal Indian diet, irrespective of whether they are vegetarian or non-vegetarian, is protein deficient. We are already protein deficient. Minimizing further or probably eliminating protein from the diet is only going to worsen the case. It will hamper their overall frailty index would get worse. They will lose muscle mass. They will not have energy. Their immunity would go for a toss. And this is only going to worsen and worsen to a point that eventually they would progress to the end stage kidney disease even faster. So my point over here said, it is very easy to manage the weakness and fragility if the patient receive a proper diet. The second point over here could be anemia is one of the important contributor to frailty and weakness. One should strive to keep the hemoglobin of chronic kidney disease patients somewhere between 10.5 to 11.5, so that the patient remains agile, patient remains active, and he's able to live his normal daily activities and perform daily activities well within his desired effect. So yes, one has to look in detail why this patient is having weakness and fragility, and one should look really into diet and probably the hemoglobin management in such patients.
Thank you, Dr. Abhyuday. Now I think we will wrap up our today's webinar. Dr. Vijay sir, I would just like to ask you, what are the health tips which you would like to give to the parent of a child that they should follow these tips to keep the kidney healthy?
You see, as I earlier said, the foundation of the kidneys, kidneys begins in childhood only. So, and prevention is better than cure. And the moment the mother conceives, we must take care of mother. Proper care and delivery must be proper. Then antenatal, I always also said, you anomaly scan and whatever to be done. Is there any congenital anomaly or not? And after this, be mindful, be mindful, be mindful. As Dr. Prasun sir says, keep monitoring, keep monitoring, keep monitoring. Take care of the hydration of the child, take care of the infection of the child, take care of the immunization of the child, take the lifestyle issues of the child, and just be mindful that kidneys are as equally important as heart and lungs and brain. So thank you so much.
And I think one more important thing is the toilet training of the child also, that they don't hold the urine for too long.
Very
Uh,
important.
And Prasun sir, I think the same, I think, what will be the health tips you would like to give to a healthy individual so that his kidney and the body remain healthy?
See, again,
Two quick
it all
tips.
boils down to how good you take care of yourself, how much aware are you of your own health, and what are the efforts and measures that you are taking to prevent it. Staying healthy overall is a basic requirement. Obesity, diabetes, hypertension, smoking, a lot, metabolic syndrome, a lot of social issues, stress, anxiety, hypertension, they will all contribute to the decline of your normal health, be it mental or be it physical. But if you are looking specifically at kidney-related issues, keep a close watch using various other techniques of labs and investigations and other things, and keep in touch with your doctor. Staying healthy is very easy provided you just monitor it. But yes, the monitoring has to be pretty sharp, critical, and constructive. This is important in terms of all disease, but for kidneys, especially renal function, as I said earlier, renal function test, a basic ultrasound, a basic urine test. If there's a family history or there are risk factors associated, please be extra watchful. Please be extra committed to yourself. Your health is your responsibility, and staying healthy is not an art. It is a requirement. You have to be healthy.
Thank you, sir. And lastly, Dr. Abhyuday, so what will be the health tip you will be giving to the audience today?
So, chronic disease is on the rise. It starts with prevention for healthy people, like Dr. Ghosh and Dr. Kejriwal just concluded the point. Early detection, prevention, and good care at the right time is very important to prevent progression of this disease. It is well controllable if caught early. So, with all the precautions that the panel has discussed today, we would probably look at to do such more sessions to create more awareness and imparting our knowledge to the general public so as to fight this disease instead of just giving up their arms in front of this. That once you're diagnosed with the problem, that's the end. That's not the end. It really matters when we diagnose this, how quickly we start treating it, and one should receive good treatment at right time. That is my message on today's World Kidney Day.
Thank you, Dr. Abhyuday. I think the message for the audience is clear. Number one, the comprehensive routine health checkup is of paramount importance. And as the summers are coming, so the hydration is most important. And we should cut down our salt intake. We should maintain a healthy weight. And if we are having diabetes or blood pressure, then controlling these two is of very paramount importance to protect our kidneys. And we should avoid unnecessary painkillers, and we should avoid self-medication. I think we would like to conclude today's session.
Why don't we ask it from somebody who's the patient himself? Is Ankur online?
Uh,
Good evening. Ankur is one of the patients who underwent a successful renal transplant here. Ankur, be very brief and share your perspective about what message you would like to give to patients like you on a World Kidney Day.
Sir, it's like everything has been discussed so clearly. Early detection is the first thing that is required. Like I failed at that time on early detection, so that is the main thing. And secondly, after going to every other place in India, finally I got to reach you through Vijay at Medanta. After that, everything was so much streamlined, everything in process. So, sir, just to be sure, like I completed 1 year on 6th of March only.
Congratulations.
So, and I was discharged on 13th or 14th. So I am having a good life. So basically, again, hypertension, stress, main thing is stress. We should completely like कुछ नहीं होना है उससे, जो होना है वो होगा. So stress should be avoided, and we should have a healthy lifestyle and early detection. मतलब whatever the case, the early detection, उस stage में आपका medication से cure हो सकता है. Other than that, this is the result. We have to go for a transplant.
Okay. Thank you, Ankur. Thank you for your input.
Thank you so much,
And
sir.
back to Dr. Deepak.
Thank you, thank you. I would like to thank all the panelists, Dr. Prasun sir, Dr. Abhyuday, and Dr. Vijay Kejriwal sir, who is our chief guest today. He has joined us from Calcutta. So thank you, sir. Thank you for joining us on the World Kidney Day and spreading the awareness. 1 hour is a very short time. Maybe we will get more insights from Vijay sir, Prasun sir, and Abhyuday sir next time. Thank you. Thank you, everyone.
Thank you, Dr. Deepak. Also beautifully this taking the discussion and so many we got aware of the this problem. Thank you, Prasun sir. Thank you, Abhyuday ji. And thank you, Ankur also. Thank you.
Thank you very much. Thank you everyone for being a part of this very exciting webinar and being a part of this panel. Thank you very much.
Thank you, sir.